And I see you. As you call out systemic discrimination, racism, and unconscious bias, as you call for action, and as you call for it now. Nos communautés subissent les inégalités.
Our communities are facing racism and inequality currently, including during the pandemic. You only have to look at a map of the cases of the pandemic in Toronto to see that Black Canadians are more hard hit by COVID-19. I'm here to listen. I'm here to listen to the concerns of Black Canadians. I've heard you speak against systemic racism, about unconscious bias as well that continues to exist. I'm ready to take action now.
The reality is that many people in this country simply do not feel protected by the police. In fact, they're afraid of them. That alone would be bad enough. But systemic discrimination and racism in Canada goes much further than just policing. It's about poverty and mental health. It's about the fact that people are all too often treated like criminals instead of receiving the support that they need. We, as governments, need to work together. We, as leaders, need to recognize that these problems are tied to economic inequality and the racialization of poverty. And we need bold measures to address this. Our government promised to address systemic racism and injustice. We knew that this work had to be informed by the lived experiences of racialized communities and Indigenous peoples. So we listened, and we worked together to change things. We invested in mental health resources and youth programs for Black Canadians. We worked to close the gaps in services for Indigenous communities. We funded Statistics Canada so they could create a gender, diversity, and inclusion statistic hub. And this work culminated in the release of Canada's anti-racism strategy for 2019-2022 and the creation of an anti-racism secretariat. Just last fall, we appointed a minister to focus specifically on diversity and inclusion. Together, we have made progress. Progress that has meant support for groups like the Black Health Alliance and new schools for Indigenous kids. But I hear you when you say that it isn't enough. I hear you when you say that it doesn't solve systemic racism. And I agree. With the many disturbing reports of violence against Black Canadians and Indigenous people, we know that we need to do much more, and we need to do it now. I had a discussion with Cabinet on Friday that will continue later today. I also spoke with Commissioner Lucky of the RCMP this morning. The Commissioner assured me that she will use all available tools to take quick, solid action. On our call, one of the things we discussed was the adoption of body cameras. I'm committing to raising this with the provinces this week so we can move forward as quickly as possible. Minister Blair has also reaffirmed to me his commitment to improving Indigenous policing. And later today, I have a stock take on reconciliation to discuss our work with Indigenous communities. I am committing to you that this work will continue to accelerate the pace of change, because you deserve real commitments as quickly as possible that addresses the root causes of these problems. Les choses doivent changer.
Things must change, but righting the wrongs of the past can't be done overnight. We have to work together, and we have to work hard. Today, I'm committing to continue to do that work, and our government will work as hard and as quickly as possible to build a fairer and better country for you.
There's no doubt that the last few months have been harder than anyone could have expected. This pandemic has meant different challenges for everyone. But no matter who you are and no matter what you're dealing with, a little bit of help can make all the difference. Maybe your employer has been able to keep you on the payroll because of the wage subsidy, a program that's supporting 2.5 million jobs. Perhaps you got some extra help through the Canada Child Benefit, or you'll receive more money with the top-up to your old age security. Or you might even be one of the 500,000 young people who has accessed the student benefit, helping you pay for next year's tuition. Au cours des derniers mois, on a travaillé
Over the
fort.
past few months, we worked very, very hard to help people get through this crisis. And the programs that we've set up and the investment we've made are making a real difference. For example, a story that Anthony Housefather told me about Franklin Empire in Montreal. They produce electronics. Now, this family business has existed for 4 generations and employs more than 500 people in Quebec and Ontario. The business was going well, but when the pandemic hit, they had to close down their workshops and their assembly line. They wanted to keep their employees on, but they couldn't do it alone. And that's when the emergency wage subsidy came into its own. They were able to rehire all their employees and with our support pay them a full salary. 500 people and families are now receiving a paycheck as they normally would despite the pandemic. That's just one example, but it shows why the programs like the emergency wage subsidy are so important. But we know that there's still a lot to be done.
On Friday, I announced that the federal government would contribute $14 billion towards a safe restart agreement with the provinces and territories for the things that all Canadians need as we get our country back up and running. Right now, we're working with the premiers on what this restart could look like in the coming months. And as we do that, we're staying focused on people's new realities. If you work in a hospital, or in a business that's reopening, you'll need PPE to stay safe. If you're back on the job, you might need transit, childcare, or the option to take time off if you're ill. If you're a senior or at higher risk from COVID-19, you may need some extra support. These are the things that Canadians are thinking about, so it's what we're thinking about too. The provinces and
the territories are all facing different realities, and we must take that into account when we think about developing the next steps. So no matter where you live, we're working with your Premier to come to an agreement on restarting the economy, which will allow us to make sure that you're safe and healthy. In addition to working on this agreement, the premiers and myself have also talked about Canadians who are separated from their loved ones because of the closure of the border. We, of course, want families to be able to come together again, but our priority must remain the safety of Canadians. Therefore, we'll be giving a limited exemption which will allow members of the immediate family of permanent residents or citizens to come into Canada. And here we're targeting husbands, wives and children. But I want to be clear, anybody who comes into Canada will have to go into quarantine for 14 days. I know that Minister Mendocino will have more detail on this later today.
This is an incredibly difficult time to be apart from a spouse, a child, or mom and dad. We hear that. That's why we're bringing in a limited exemption to allow immediate family members of citizens or permanent residents to come to Canada. I want to be clear, though. Anyone entering the country will be required to quarantine for 14 days. And if you don't follow these rules, you could face serious penalties. I know that Minister Mendocino will have more to say about all of this later today. I
know that after the very difficult spring, many people hope that the summer will be easier. Things are starting to get better for everyone. But we know that there's still a lot that needs to be done. And Canadians can count on our support in the months and weeks ahead. Thank you very much. Thank you, Prime Minister. We'll start with the phone lines today. Operator, over to you.
Thank you. First question, Brian Lilly, Toronto Sun. Line open.
Good morning, Prime Minister. You've spoken often about the need for the provinces to be cautious in reopening. Last week, you specifically said that you want to be clear we're not out of the woods. The pandemic is still threatening the health and safety of Canadians. So I want to ask you about the fact that so many Canadians did participate in protests over the weekend. Some were wearing masks, some were not. Some were social distancing, and others were not. But a lot of Canadians are looking and saying, I've lost my job because I followed the rules. I couldn't go to a family's family member's funeral because I followed the rules. What do you say to Canadians who are sitting and saying, I understand the issues of racism, I understand the issues the protesters were raising, but I've lost out on nearly 3 months of my life due to this. Can you continue to support the lockdown measures that have been in place?
We've seen thousands of Canadians come out this weekend and over the past days to highlight their deep concerns and stand in solidarity with racialized Canadians and Indigenous Canadians. Again, as you pointed out, we saw many efforts made to wear masks, to continue social distancing. It is important that we follow public health advice throughout, even as we protest and demonstrate in order to create a better world. We have to get that balance right, and I continue to exhort Canadians to do just that.
Well, over the past few days, we've seen thousands and thousands of Canadians come out to demonstrate against the systemic racism and inequality that exists, especially for racialized Canadians and Aboriginal Canadians as well. We've also seen many people wearing masks, exercising social distancing. They've been following the Health Canada guidelines, and we need people to continue to follow those public health guidelines. Even during these demonstrations, it's important for us to be careful and to do what needs to be done to get through this pandemic.
Steps from where you took a knee, though, Prime Minister, there was an Ottawa restaurant allowing customers to eat their pizza socially distanced on a patio. They're facing an $880 fine for violating the same emergency orders that you violated, that many of the people at the protest violated. So can you continue to say that we've got to have these lockdown measures in place when there is obviously a difference of how they are applied between people meeting on their driveways, people eating pizza, and people protesting?
Thank you for your question, Brian. I mean, there's a lot of people wondering about what exactly is the right thing to do, what the coming weeks and months will hold for us. One of the things that we've seen very clearly from other jurisdictions, including places like South Korea and others, where a strong handling of the crisis at the beginning has given way to some resurgences here and there, is that as we loosen some of the population control measures, as people are returning to work in some ways, seeing businesses reopen, we need to step up in other ways. We need to continue socially distancing. We need to wear masks where appropriate. But we also need to make sure that we are stepping up on things like contact tracing and exposure notification and massive testing. There are many more things we need to do. Even as we restart the economy, we need to bring in other measures as well to ensure that we can handle any resurgence. All this is difficult and frustrating and longer than we'd hoped it would be in many ways. But at the same time, we know that the cost of having to return into social isolation, return into lockdown because of a massive resurgence is not one that anyone wants to bear, which is why we are being very cautious going forward, and we continue to encourage people to follow all public health advice and guidance.
Thank you. Operator, next question.
Thank you. Merci. Prochaine question.
The next question comes from Raymond Fillon from TVA. Over to you. Hello, Prime Minister. Are you concerned that these demonstrations that we saw will actually increase the number of cases? And you were there in the midst of the crowd on Friday. Will you be getting tested? Well, Ray, as you've all seen, I took the necessary measures. I did what I could. I was wearing a mask. I practiced social distancing as much as I could. But of course, there has to be a balance. There's a delicate balance that has to be struck. If you're unable to actually adhere to social distancing measures, if you can't wear a mask and wash your hands, well, it's difficult. But people really feel a deep need to go out and demonstrate, to show their solidarity with racialized Canadians, with Aboriginal Canadians, those facing systemic discrimination that continues to exist across the country. But at the same time, we have to keep our distance, and we have to do everything we can to stop the spread of COVID-19.
We've seen that people feel a deep need to stand in solidarity with racialized Canadians, with Indigenous Canadians who continue to face unacceptable levels of systemic discrimination in this country. This is a time for people to make sure their voice is heard, but it's also a time in which we need to follow public health instructions as best as possible, which is why I and many others wore masks, even as we tried to keep our distances in those massive crowds. But we need to make sure we're getting that balance right of looking to build a better world, looking to ensure that real change happens now and into the coming months, while at the same time ensuring that we slow and decrease the spread of COVID-19.
Suivi, Ray?
A follow-up? Yes, we saw you on Friday take a knee. What did that mean for you? Can you explain? Well, for me, it meant I was showing respect for the demonstrators around me. I was showing that not everything's okay. We do have a system that continues to discriminate against black people, against racialized people, against Aboriginals as well. And therefore, we must show that even if we live in an extraordinary country, perhaps the best in the world, we still have a lot to do to make sure that everyone in Canada feels that they live in the best country in the world. That's not the reality for many people. So for me, taking the knee was a sign of respect and solidarity with these people. The next question, Hélène Buzetti from The Devoir. Hello, Mr. Trudeau. I'd like to pick up on the $14 billion you promised to the provinces. Have you agreed on a distribution formula? Mr. Legault has said that it should not be based on the traditional formula per head of population. He said it should be based on the scale of the pandemic in the provinces. So Ontario and Quebec would get more under that formula. Well, they will be receiving more because of their population. We know that many jurisdictions have not had many cases of COVID-19, but despite that fact, they have had to suspend many services, health services, for example, and there are additional costs for them as well, so that they can actually plan for a second wave. This is all part of the negotiations that are underway with the provinces. But the starting point really is that we're here to make sure that Canadians across the country have access to what they need. Be it PPE, be it childcare, be it assistance for seniors, assistance for municipalities as well. We have to make sure that we can actually get the economy restarted safely again. I'd like to pick up what you said in your speech about body cameras for the police. Now, your position on the RCMP, what is it exactly? Should they be wearing these body cameras? And when you deal with this issue, or you dealt with this issue with the provinces rather, what was the reaction? Were they open to the idea? Well, I talked to the premiers about the need for concrete action. We didn't directly broach the issue of body cameras for the police, but this is something that I will be raising with them over the next few days during our weekly call this week, for example. Now, at the federal level, we have jurisdiction over the RCMP, but the provinces have jurisdiction over their own provincial and municipal police forces as well. So we must work together. But body cameras are certainly something which will increase transparency and raise accountability. And I think that's very important for the police across the country to do that.
On Thursday last week with the premiers, I highlighted the need for us to take concrete, direct actions to move forward on systemic discrimination in this country, on moving forward together on making real change so that more Canadians can feel safe and respected in their own country. This is a challenge that has gone on for far too long and requires concerted action across all orders of government. In regards to body cameras, it didn't come up in our conversation last Thursday, but certainly moving forward this week, it will come up. As you know, the federal government has jurisdiction over the RCMP, but there are many other provincial and municipal police forces that should be looking at greater transparency measures as well, and I will certainly be talking about with the provinces and premiers about the need to move forward on measures like body cameras.
Thank you. Operator, last question on the phone. Dernière question téléphone.
Yes, thank you. Merci. Last question, Christy Kirkup, the Globe and Mail. Line open.
Good morning, Prime Minister. In recent days, Athabasca Chippewa First Nation Chief Alan Adam has alleged that he was beaten by the RCMP. He has shared pictures of his bloodied face and swollen eye. Given this incident and many others that have come to light, how can Canadians be confident that there are mechanisms in place to ensure that there is someone policing the police?
We have obviously all seen and been deeply alarmed by the pictures that Chief Adams shared. Obviously, Minister Miller has engaged with the Chief directly multiple times over the past days. We need to do more. We need to take significant measures to move forward. We brought in an RCMP management board a number of years ago when as we committed to, that is helping with civilian oversight over the RCMP, but there is more to do, and that is a conversation I had with Commissioner Lucky this morning, and I will continue working with her and with all of our partners on ensuring that we bring forward significant, concrete and rapid measures to address these issues. Nous avons tous été perturbés.
Well, we were all very, very disturbed by the photos shared by Chief Adams a few days ago. Minister Miller has been in direct touch with him, and I talked to Commissioner Lucky of the RCMP this morning. We must work together so that we can actually expedite change within the RCMP. We've already taken additional steps over the past few years to ensure greater accountability within the RCMP, but we do recognise that there's much more that needs to be done, and we'll continue to work together over the next few days and months to put forward new measures.
Prime Minister, 5 years ago, the Truth and Reconciliation Commission highlighted systemic issues between police and Indigenous people. The National Public Inquiry that your government called on missing and murdered Indigenous women did the same. Have you given any consideration to appointing someone in your cabinet to assess allegations of systematic racism and to be tasked with taking action on it?
We have not waited for those reports to move forward. We have been taking action on these systematic challenges, whether it was bringing in new review and oversight management boards for the RCMP, whether it's moving forward on Statistics Canada, being better able to work with disaggregated data, whether it's working more directly with community organizations and giving them the funds to be able to develop programs that can help. There are many things we've done, including directly within the National Police Force in terms of bringing forward significant measures and transformations. But there is much, much more to do. We appointed a Minister of Diversity and Inclusion for the very first time last fall, and she has been tasked with looking directly at these issues, and our Minister of Public Safety has, of course, the mandate to ensure that we are fighting against systemic discrimination in everything we do.
Bonjour, M. Trudeau. Louis Blouin de Radio-Canada. Vous avez dénoncé...
Mr. Trudeau, you've spoken out against systemic racism, but experts and committees have made recommendations for years now. We're still waiting to see concrete steps, creating an independent investigation organisation to look at police brutality against Aboriginals. Do you think that we'll be seeing this type of organization or body in the next few years? Well, we're looking at everything that's been done to ensure transparency and accountability, but we are ready to do what it takes to create new structures, new bodies, or to strengthen existing bodies. This is the conversation I had with the Commissioner this morning. This is the conversation we're having around the Cabinet table. We know we need to act in a concrete fashion. We know we need to strengthen existing measures and perhaps add new ones. That's what we're doing this week. A year ago, the investigation on missing and murdered Aboriginal women wrapped up. There was a report. One of the recommendations was to create a body to provide oversight of the police. Nothing's been done. When will you act? Well, the RCMP has already set up committees across the country to work with Aboriginal peoples, but we do recognise that there's more to be done. And this is what we're currently looking at this week. We'll be having conversations about what more we can do, where we have to do much more, what steps we need to take to make sure that concrete action is taken. We can't just stop at intentions. We have to put our money where our mouth is, and that'll transform the future, I think, for lots of people.
Over the past years about fighting against systemic discrimination, whether it has been creating better oversight of the RCMP, which we've moved forward on, whether it's the RCMP Commissioner setting up Indigenous advisory councils right across the country to better respond to what they're doing. We've done a number of things, but we know we have to do much more. And that's what we're talking about this week, looking at concrete measures where we can strengthen certain existing bodies, where we might need to bring in new bodies, where we can move forward on different measures. There's a range of things that obviously we need to do. The intention has been there to fight systemic discrimination in this country. We now need to do even more in terms of actions to make sure that gets done.
Hi, Prime Minister. Tom Parry, CBC. I'd like to ask you about your own decision to attend the rally on Friday. This was clearly something that was important to you, but you've been telling Canadians for weeks to avoid doing things that are important to them. So why did you decide to go against your own advice? And also, you were asked earlier whether you're going to get tested. Are you?
I will continue to follow public health protocols in terms of getting tested. I'm open to getting tested, obviously, but when I was in isolation because I was in proximity with my wife who had tested positive, it was determined at the time that I didn't need to get tested because I was isolating and I showed absolutely no symptoms. I continue, obviously, to show no symptoms. In regards to the rallies, it was important for me to attend. I think to look out the windows of my office and see thousands upon thousands of young people, of Canadians of all ages, stand in solidarity to wanting to see change happen, I felt it was important for me to be part of that, to be able to listen, to be able to hear people, and to be able to understand and to share with people how important it was to act on it. I, as best I could, followed social distancing measures, wearing a mask, keeping distance where possible. But I recognize that it is a difficult situation where we are trying to balance very important competing interests. But for me, it was important that I be there to hear. Well,
I think we're in a situation where we're constantly required to make tough choices. We must endeavour to follow public health guidelines, and this is what I've always tried to do. But I did think, however, that it was very important for the Prime Minister to be at the demonstration, to listen and to hear the voices of thousands of Canadians who want us to take firmer and quicker action to deal with systemic racism in this country. That's the choice I made, and I think it was the right choice. Well, as you know, I was in isolation several months ago when Sophie tested positive for COVID-19. So I was told that because I didn't have symptoms, I didn't need testing. But I'm still prepared to get tested if I need to.
This is Something that you think should happen then? You think that the RCMP officers should be wearing these cameras? And also in your conversations with the commissioner, is she saying that, does she think that her officers would be willing to wear these cameras?
I think these are discussions we need to go forward on the logistics, on the cost, on the cost to provinces where there is contract policing in place. But the challenges that I've heard are more logistical and economic concerns about remote areas and the way those cameras would work. But yes, it is something that is, in my opinion, what we need to move forward with. Okay. Well,
in my discussions with the Commissioner this morning, we talked about body cameras. Well, the challenge with the cameras are more logistical in nature or economic in nature, if you like. They're not substantial, however. There are also some technical challenges, but I think we both agree that we should move forward with these cameras for our CMP officers.
Hello, Prime Minister. It's Annie Oliver with CTV National News. You took a knee at Friday's rally, showing your support for the Black Lives Matter movement. Many of the protesters we spoke with said that they appreciate the symbolism, but they want concrete actions to show that that was not just a photo op. You mentioned body cameras in your speech, but many advocates say that's simply a Band-Aid solution. So I'm wondering, what firm steps will you take immediately to begin addressing systemic racism in Canada?
Well, I think, first of all, body cameras is a significant step towards transparency, and we're, as I've said, going to work on that this week. We're also going to move forward on looking at various review structures and oversight commissions at the policing level to make sure that they have the powers and the abilities to do what needs to be done. But when we talk about systemic racism, it's easy and important to look at policing in this country as being a key challenge. But the drivers of systemic racism are far greater than just policing. They're socioeconomic factors, they're inequalities, long-standing inequalities, the racialization of poverty is a reality in this country. And we need to make sure that we are addressing all of those at the same time. That is why, as a cabinet, as a government, as a country, we will have many important conversations, but I hear very clearly that as much as we have made strong efforts over the past years on stepping forward in the right way, it hasn't been enough. We have to do much more, and we will.
You've also said that the protests are calling for action now, and one of the clear calls that we're hearing is to reduce police budgets and to redirect money to better support Black communities. Minneapolis announced that it will do just that, and I'm wondering whether you will review the RCMP budget.
Well, I think there's always a need to review every dollar, every public dollar spent to ensure that we're getting the best results out of it, that what we're doing is the best thing to keep Canadians safe. That's something that Canadians expect of their governments, and we will continue to do that to ensure that budgets are spent appropriately, the budgets themselves are appropriate, and make sure that we're also investing in all the things that need to be invested in to ensure truly safer communities. Okay. Well,
I think that people expect for us to review spending on an ongoing basis to ensure that we're actually spending on the right things, that we're funding the right programs, the right tools to keep all Canadians safe. And this is something that we'll continue to do.
Minister, the Migrant Workers Alliance for Change says more than 1,000 complaints on behalf of migrant farm workers went unheeded by federal and provincial authorities ahead of these recent COVID-19 outbreaks. Why didn't your government do more to ensure these essential workers were safe?
No one in Canada should be at greater risk of COVID-19, and we know we need to do better by migrant workers. Temporary foreign workers in Canada have an extremely important role to play in our agricultural systems. We've had many discussions with the agricultural industry and with migrant worker organizations to ensure that we were putting measures in place that would allow both isolation and the important work in assuring Canada's food supply continues. Of course, we will be continuing to listening to them and looking how we can make things better going forward.
Cramped living conditions, working long hours, and close proximity. Advocates have been complaining about these issues for decades. Will your government consider giving migrant workers permanent resident status so they can assert their right to a safe workplace?
We need, whether they're permanent residents or whether they're simply temporary foreign workers, we need to do a better job of protecting temporary agricultural workers in this country, temporary foreign workers in this country. We have taken a number of steps, but there's more to do, and we will do it.
Merci beaucoup. C'est ce qui m'a fait la conférence de presse d'aujourd'hui.
Merci tout le monde.
Hello again, I'm Marc-Andre Cassette, and you've just
Bonjour tout le monde. Good morning, everyone. Thank you for being with us again. Today we'll have the pleasure of hearing from Dr. Theresa Tam, who is Canada's Chief Public Health Officer, from Dr. New, who is Deputy Chief Public Health Officer, and from Minister Marco Mendicino, who is Minister of Immigration, Refugees and Citizenship. Dr. Tam.
Good afternoon. Bonjour. So as of end of the day, Sunday, June the 7th, there are now 95,699 confirmed cases of COVID-19, including 7,800 deaths. 54,233, or 57%, have now recovered. Labs across Canada have tested over 1,896,000 people for COVID-19 to date, with about 5% of these testing positive overall. Over the past week, we have been testing an average of 33,000 people daily. Again, these numbers can change quickly, and they're now being updated once daily in the evenings on canada.ca/coronavirus. Across the country, the COVID-19 epidemic is continuing to slow down, with daily case counts continuing to decrease, even in Canada's most affected provinces, Ontario and Quebec. The trouble spots where COVID-19 transmission is continuing include a number of outbreaks, but more concerning still are areas with community spread of the virus. Although outbreaks are problematic, they can be easier to manage with contact tracing and targeted public health control measures, especially if tied to a single setting. Community transmission, on the other hand, can be harder to manage, depending on how widespread virus activity is. This is why some of Canada's hotspots have been a persistent challenge, contributing to fluctuations in the national growth rate. Provinces have been mobilizing more testing to trace and control any lingering chains of transmission in these most affected areas. Taken together, these trouble spots remind us we've got to continue our path down the curve with extreme care, maintaining physical distancing and hygiene practices everywhere to make sure that there are no new flare-ups. I know it's been difficult dealing with these weeks and months of uncertainty, and despite the fact that we're not there yet and that we still don't know what lies ahead, there is one thing that has become clear, is that Canadians will unite with determination to get through adversity together, and will keep on doing it to protect our families, our communities, and our society. When we began this journey, I had believed in the strength of Canadians, but what I have seen over these difficult months has been so much more than I imagined, and it's enough to give me assurance we'll get through the uncertainties ahead too. Thank you. Merci.
Thank you very much, Dr. Tam. Dr. New, please.
Merci. À la fin de la journée de dimanche 7 juin, on dénombrait
of the day Sunday, June 7th, there are now 95,699 confirmed cases, including 7,800 deaths. 54,233, or 57%, have now recovered. Labs across Canada have tested over 1,896,000 people for COVID-19 to date, with about 5% of these testing positive overall. Over the past week, we have been testing an average of 33,000 people daily. These numbers change quickly and are now being updated once daily in the evenings on canada.ca/coronavirus. COVID-19/coronavirus.
L'épidémie de COVID-19 continue
Across
de
the
ralentir
country,
partout
the
au pays.
COVID-19 epidemic is continuing to slow down, with daily cases continuing to decrease, even in Canada's most affected provinces, Ontario and Quebec.
Les points chauds où
The
la
trouble
maladie
spots
continue de se
where
propager
COVID-19
comprennent un certain
transmission is
nombre
continuing
d'éclosions,
include
mais ce
a
sont les
number of
régions où
outbreaks,
nous
but more
observons une
concerning
transmission
still are areas
communautaire
with
de tout
community
virus
spread of the
qui nous
virus.
préoccupe davantage. Bien que les éclosions
Although
soient
outbreaks
problématiques,
are
elles
problematic,
peuvent être plus
they
faciles à
can be
maîtriser
easier
par la
to
recherche des
manage with
contacts et la
contact
mise en
tracing
place des mesures de contrôle
and
sanitaire
targeted
ciblées,
public health
surtout
control
si elles sont
measures,
associées
especially
avec un
if
seul
tied
milieu.
to a single
La
setting.
transmission communautaire,
Community
quant à elle,
transmission, on
peut
the
être
other
plus
hand,
difficile à
can be
gérer
harder to
selon
manage,
son ampleur.
depending on how
C'est pourquoi
widespread
certains
our
points
virus
chauds du
activity
Canada
is. This is why
continuent
some
de
of
poser un
Canada's
défi,
hotspots have been
faisant fluctuer le
persistent,
taux de croissance
challenge
nationale.
contributing to
Les
fluctuations in the
provinces
national
effectuent
growth rate.
plus de tests afin de
Provinces have
repérer
been
et de
mobilizing more
briser les chaînes
testing
de
to trace and
transmission
control
qui persistent
any
dans ces
lingering
régions
chains of
les plus
transmission in
touchées.
these most affected
Plus
areas.
ensemble, ces
Taken
points chauds nous
together, these
rappellent
trouble spots
qu'il faut
remind
demeurer
us
extrêmement
that
prudent
we've
pour
got to
aplatir la courbe
continue our
en
path
maintenant
down
les
the
mesures de
curve with extreme
distanciation
care,
physique et
maintaining
d'hygiène
physical
partout pour
distancing and
qu'il n'y
hygiene
ait
practices
pas de
everywhere
nouvelles
to make sure
recrudescences.
that there are no new
Nous sommes
flare-ups.
conscients que ces semaines
I know
et
it's
ces
been
mois
difficult
d'incertitude
dealing with these
n'ont pas
weeks and
été
months of
faciles.
uncertainty.
Même si nous ne
And
sommes pas au
despite the
bout de
fact
nos
that we are
peines
not there
et que
yet,
nous ne savons
and
toujours
that we
pas
still don't
ce
know
qui nous
what lies
réserve
ahead,
l'avenir, une chose est
there's
maintenant
one
claire.
thing that has become
Les
clear.
Canadiens s'uniront pour
It's that
faire face à
Canadians will
l'adversité
unite with
avec
determination
détermination
to get
et
through
continueront
adversity
de le faire
together,
pour
and
protéger
we'll keep
leurs
on doing
familles,
it to
leurs
protect our
collectivités
families, our
et la
communities,
société.
and our society.
Lorsque nous avons entrepris
When we
cette
began
lutte,
this
nous
journey,
croyions en la
I had
force des
belief
Canadiens,
in the
mais ce que nous avons
strength
vu en
of
cours de
Canadians,
cette
but
période
what
difficile
I've seen
dépasse
over these
tout ce que
difficult
nous
months
aurions pu
has
imaginer.
been so much more
Et cela
than
me
I
donne
imagined, and it's
l'assurance
enough to
que
give
nous
me assurance
parviendrons à
that we'll get
surmonter
through the
également
uncertainties
les incertitudes
ahead too.
à l'horizon. Merci.
Thank you.
Merci, Dr. New.
Thank you, Dr.
Je
New.
passerai maintenant la parole à
I'll now give the
Marco
floor
Mendicino,
to
qui est
Marco
ministre de l'Immigration,
Mendicino, the
des Réfugiés et de la
Minister of
Citoyenneté.
Immigration,
Marco.
Refugees, and Citizenship. Marco.
Merci, Jean-Yves.
Thank you,
Good
Jean-Yves.
afternoon, everyone. I'm pleased to be here today to make an important announcement regarding the measures we are taking to protect the health and safety of all Canadians at our borders. In response to the COVID-19 pandemic, Canada entered into a reciprocal agreement with the United States banning all non-essential travel between our two countries. Similar restrictions were put into place for all other international travel. We also made sure when these special measures came into force that the flow of goods and essential services into Canada would continue unimpeded by allowing temporary workers, students, and visa holders to enter in a safe and orderly manner, all of whom are subject to the mandatory 14-day isolation period upon arrival. This approach has ensured we continue to get access to the food, fuel, and medical supplies we need without putting in jeopardy the health and safety of Canadians. While the border measures have been part of the government's overall response to COVID-19, we also recognize that they have had a significant impact on personal and discretionary travel. In some cases, and as a necessary precaution to reduce the risks associated with COVID-19, families have been separated under the terms of the non-essential travel agreement between Canada and the United States. We acknowledge that this has been difficult. Where appropriate, our officials at the border have exercised their discretion responsibly to resolve individual matters on a case-by-case basis. Over the last several weeks, we've worked hard to address the question of how best to keep families together in a compassionate way, but measured against the ongoing concerns related to the transmission of the virus. Following a review of our current policies, and in consultation with our public healthcare experts, as well as the provinces and territories, we now have a path forward. Today, I'm pleased to announce an exemption under the current travel restrictions that will allow the immediate family members of Canadian citizens and permanent residents to enter into Canada. A number of important conditions must be satisfied before this exemption will apply. First, immediate family members will be defined as spouses, common law partners, dependent children, and their children, parents, and legal guardians. Second, immediate family members must plan to stay in Canada for at least 15 days. And third, all other public health care protocols, including screens at the border, remain firmly in place. Here, I would make specific reference to the fact that anyone permitted entry under the immediate family exemption will still have to self-quarantine for 14 days as soon as they enter Canada. To be clear, the immediate family exemption does not mean the border will now be open to weekend travelers or those seeking just to attend a personal or social gathering. For people traveling from abroad, they must still have a valid visa or electronic travel authorization. The purpose of this measure is not to allow people to come and go into Canada whenever they like, but rather to help Canadian families reunite during this unprecedented time. Today's announcement represents a responsible step, an incremental step, one that we will monitor carefully as we continue to maintain the integrity of our borders. Aujourd'hui, je suis heureux d'annoncer une dérogation à l'interdiction d'entrée pour les membres de la famille immédiate des citoyens canadiens et des résidents permanents, mais uniquement s'ils souhaitent entrer au Canada pendant un minimum de 15 jours. Les membres de la famille immédiate seront définis ainsi. Les époux, les conjoints de fait, les enfants à charge et leurs enfants, les parents et les tuteurs légaux.
And legal guardians.
Permettez-moi d'être clair. Les exigences de santé publique restent en place. Toute personne exemptée de l'interdiction devra se mettre en quarantaine pendant 14 jours de son entrée dans le pays. Cela ne signifie pas que la frontière sera ouverte aux voyageurs l'instant d'un week-end ou à ceux qui souhaitent entrer pour assister à un événement. Cette mesure est mise en place pour aider les familles canadiennes et se réunir et non pour permettre aux gens d'aller et venir comme bon leur semble. In closing, COVID-19 remains a concern, and we must continue to take measures at the border that are necessary from spreading it, and the measures today represent an incremental, a responsible, and a thoughtful response towards that objective. Thank you. Merci.
Merci Marco pour cette annonce importante au sujet de la réunification des membres proches des familles de citoyens canadiens ou de résidents permanents. Et nous serions maintenant très heureux et certainement prêts à répondre à vos questions.
Thank you, Minister. As usual, we'll start with 3 questions on the phone before we turn to the room. 1 question, 1 follow-up. Operator, over to you.
Thank you. Merci. Please press *1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. And the first question, la première question, is from Raymond Fillon de TVA. À vous la parole.
Oui, bon après-midi. Une question pour Dr. New. Vous avez parlé, Dr. New, de l'importance dans votre déclaration tout à l'heure, et Dr. Tam l'a fait aussi, l'importance de maintenir la distanciation physique. Vous avez dit on n'est pas sorti du bois. Alors, est-ce que vous êtes inquiet des images que vous avez vues en fin de semaine de ces manifestations?
Merci pour la question.
Thank you for the question.
Oui, c'est vraiment, d'après moi, comme 2 enjeux importants. Le premier enjeu, on sait, c'est vraiment important. C'est un moment historique dans l'histoire du Canada, aussi même dans le monde, avec la reconnaissance de tout le monde des inégalités dans notre société. Partout dans le monde, ici au Canada, on voit qu'il existe, comme on dit, le racisme systémique. Il y a aussi des inégalités. Donc, moi, je peux même constater comme un médecin hygiéniste spécialiste dans le domaine de santé publique que les inégalités de notre société vont aussi avoir un effet sur la santé de beaucoup, d'une grande partie de la population. Et donc, je dis ça comme un spécialiste dans le domaine technique de santé publique. Alors, comment est-ce qu'on peut faire pour ça? C'est sûr, il y a plusieurs façons de montrer à tout le monde qu'on reconnaît ces inégalités, il faut faire quelque chose, il faut changer le système. Et une des choses importantes de notre démocratie, c'est savoir les manifestations. Mais on comprend aussi, moi je comprends aussi que les manifestations maintenant se passent dans la pandémie de COVID-19. Donc, je pense qu'il y a un équilibre. Moi, si je parle strictement de côté de santé publique, tout le monde sait, moi j'ai répété aussi avec Dr. Tam plusieurs fois, c'est quoi les mesures de santé publique importantes peut-être à pratiquer pour minimiser le risque d'attraper et être contaminé avec le COVID-19. C'est la distanciation physique de 2 mètres. Si ce n'est pas possible, utiliser un couvre-visage, un masque non médical, avoir beaucoup de désinfectants pour les mains, des choses comme ça. Donc, ce que j'ai vu avec les images, beaucoup des personnes qui ont participé ont utilisé une couvre-visage. Quelques images, j'ai vu aussi il y a pas mal une bonne distance entre les personnes, mais honnêtement, c'est toujours possible qu'il y a une possibilité avec qu'est-ce qui s'est passé, il y a un risque. C'est la vérité. Et je pense que tout le monde qui a participé ont fait, j'espère, comme une auto-évaluation de leur propre risque. Ils ont pris toutes les mesures possibles pour être le plus sécuritaire possible. Et c'est ça, on verra qu'est-ce qui va se passer dans les semaines suivantes. Merci.
Vraiment suivi?
Oui, j'étais à la manifestation d'Ottawa vendredi sur la colline du Parlement. Je peux vous dire, il n'y avait pas de distanciation physique à bien des endroits. Les gens étaient très près les uns des autres. Est-ce qu'on doit donc s'attendre à une hausse des cas et est-ce que le premier ministre qui était présent devrait se faire tester?
OK, merci pour la question suivie. Comme on a déjà dit aussi plusieurs fois que c'est difficile de garder une distance de 2 mètres, c'est très important aussi d'utiliser des autres moyens, particulièrement l'utilisation d'un couvre-visage, un masque. Et ce que j'ai vu aussi avec les photos, les images, qu'il y a beaucoup de monde qui ont utilisé ça. Donc, c'est une mesure supplémentaire de protection. Donc, pour tous les manifestants qui ont participé, maintenant, je pense que c'est aussi de continuer à pratiquer les bonnes mesures personnelles, aussi mesures de santé publique. Et c'est une question de suivre les symptômes. C'est vraiment, on s'inquiète un peu parce que peut-être qu'il y a une possibilité d'exposition. Ce qu'on sait avec la période d'incubation, normalement, ça prend environ 5-6, peut-être une semaine. Donc, ce n'est pas une bonne idée de faire un dépistage, un test tout de suite parce que c'est possible que même si on était infecté, contaminé avec le virus, peut-être on n'a pas assez comme un fardeau de virus dans le corps pour rendre un test positif. Donc, c'est mieux de continuer à pratiquer toutes les bonnes mesures de distanciation physique, se laver les mains fréquemment, tout ça. Et il faut aussi faire une auto-surveillance pour les symptômes. Et si on s'inquiète, peut-être on peut toujours aller considérer faire un dépistage, un test, peut-être comme une semaine après l'événement.
Merci, docteur. Opérateur, prochaine question, s'il vous plaît.
Next question, please.
Thank you. Merci. The next question, la prochaine question, is from Mike Blanchfield from the Canadian Press. Please go ahead.
Yeah, a question for Dr. Tam. Did the Prime Minister seek advice from your office before going to Parliament Hill on Friday? And what did you think about the message that sends to Canadians from a public health point of view to see a Prime Minister in such a large crowd like that, notwithstanding his reasons for wanting to be there?
Yes, so I essentially provided advice to all Canadians and then provided some messaging to that effect. So as Dr. New also said, that this is a very difficult situation to look at the balance. Absolutely, Canadians have a right to protest, and racism, anti-Black racism, is a long time in the making and is a health equity issue. So on the other hand, mass gatherings, particularly situations where there are larger crowds where physical distancing is difficult to achieve, does create a public health risk. So we're living in a time of a pandemic. But I think it would be unrealistic for public health to think that protests wouldn't happen. So in that instance, our job is to provide the actual advice for people to how to keep themselves as safe as possible. And that advice applies to anyone. And so one is to look at your own personal risk and whether you have higher risk factors for developing severe illness, for example. You have to look at the situation and bring a mask and wear it if you can't maintain that physical distancing, having hand sanitizers. And but it is quite a difficult situation to control, and I think public health will be watching very carefully for any increases in transmission, because it is a setting of risk. Even though it's outdoors, it's just people are quite close together, maybe for a significant period of time. So as a result, I think people who participated in mass gatherings should evaluate what actually happened to them in that setting, monitor their own symptoms. If you're worried about potential exposures, contact your local public health for a direction on testing. And so, yeah, it's a tricky situation, but I think from a public health perspective, we were just trying to be realistic. It's a bit like a harm reduction approach. People are going to want to exercise their rights, and this is an extremely important issue for Canadian society. So we have to provide the instructions should people, can't do protests virtually.
Mr. Blanchfield, follow up.
Yeah, from a public health point of view, again, Dr. Tam, will police wearing body cameras improve the safety and health of vulnerable populations? And do you support again, from a public health point of view, the transfer of funding from police to non-policing interventions to deal with mental health issues and other social supports?
Well, what I can speak to more generally is that stigma in all of its forms, discrimination, and the health inequities that ensue is a public health issue. And racism, homophobia, transphobia, sexism, all of those manifestations of stigma and discrimination impacts health in at least three fundamental ways. I think most importantly, it impacts access to the resources that promotes good health, access to the healthcare system, access to social services, education, and all those support systems. Secondly, it can lead to direct effects on health, including physical injury and violence-related health conditions. It also can lead to chronic stress, which can lead to increase in mental health concerns and physical health concerns, which increases your cardiovascular disease or your blood pressure, which of course also is a risk factor for COVID-19. So it's a complex intertwine of issues. And so I think that policymakers and society writ large in every sector, whether it's law enforcement and others, should carefully examine all the ways in which we can all do our part, including the healthcare system, in reducing stigma and discrimination writ large.
Merci, Dr. Tam. Opérateur, prochaine question, s'il vous plaît.
Thank you. Merci. The next question, la prochaine question est de Brigitte Bureau de Radio-Canada. À vous la parole.
Oui, bonjour, Monsieur Mendicino. Des vols s'organisent pour rapatrier des Canadiens
Flights
du
are being
Pérou la semaine
organized to bring
prochaine.
Canadians back
Une
from Peru
Canadienne,
next
c'est un
week.
exemple parmi d'autres.
This is one
Elise Craig
example.
veut rentrer au pays avec
Elise
son mari
Craig wants
péruvien,
to
mais
come home
Immigration
with her
Canada lui a
Peruvian
refusé un visa de
husband,
résidence
but
temporaire.
she
Est-ce que
was
son mari et
he
les
was
membres
refused
d'autres
a
familles
visa for
canadiennes qui vivent
temporary
des situations
residency?
semblables vont maintenant
Will
pouvoir
Canadians in these
entrer au Canada?
situations be able to enter Canada now?
Donc, comme j'avais dit, il y a un système qui est en place, qui a besoin des contrôles pour protéger la santé et la sécurité des Canadiens. L'annonce cet après-midi est pour créer une exemption qui s'applique à les relatives et les membres de la famille qui sont très proches des citoyens canadiens et des résidents permanents. Toutes les règles qui sont en place pour réduire les risques qui sont attachés à COVID-19 rester en place. Et quand il y a des enjeux qui sont élevés, nous évaluons cas par cas.
Oui, est-ce que les membres des familles immédiates vont devoir obtenir des visas de visiteurs? Est-ce qu'il va y avoir des formalités à remplir? Et si oui, est-ce que vous allez vous assurer que vos fonctionnaires vont agir très, très rapidement parce que dans certains cas, ça presse, au Pérou notamment, on sait qu'après ces vols, il y en aura peut-être plus pour des mois.
Comme j'avais dit, il y a quelques circonstances où il y a une urgence où l'objectif de le voyage sont essentiels. Il existe une discrétion qui sont là, mais cette discrétion sont exercice avec beaucoup de responsabilités et pour accomplir l'objectif de protéger la santé des Canadiens et s'applique même pour les membres qui sont avec un visa.
To people with a visa.
In English, I'm sorry. As I have said, the announcement today relates to creating a family exemption for the immediate family members of Canadian citizens and permanent residents. It ensures that the public health care controls remain in place, so even where this exemption applies, everyone entering under it must still abide by the mandatory 14-day isolation period. And with regards to those immediate family members who are related to those who hold valid visas here, this exemption does not apply. But there is still a residual discretion which looks to assess all of the circumstances and ensures that the purpose of that travel is necessary without in any way compromising the health and safety of Canadians.
Thank you, Minister. We will now turn to the room for questions, starting with Annie from CTV.
Yeah, I guess I can't take this off. Hi, it's Annie Bergeron-Oliver with CTV National News. My question is for Dr. Tam as well as Minister Mendicino. So we're opening the border today for family reunifications, and you just talked about the need for this 14-day quarantine. However, with rules loosened right across the country in terms of who can get a test, I'm hearing from more and more Canadian international travelers who are getting tested the day they come back into Canada. And if that test is negative, they are skipping the 14-day quarantine. So one, is this accurate, that international travelers, when they land into Canada, if they have a negative test, they no longer have to quarantine? And two, what assurances do you have that Canadians who are coming in or travelers are indeed abiding by that 14-day quarantine rule?
So your initial statement is incorrect. Everyone who comes in who is not exempted, like an essential service worker who's driving a truck who has to go past the border. If you so then everyone is mandated under the Quarantine Act to be in quarantine for 14 days. And we will examine the role of laboratory testing. But if you can imagine, if you test negative on the first day, that doesn't actually mean that you're not actually incubating the virus, because we know the incubation period in general is about 5 or 6 days, but it can be as longer than that. So the Quarantine Act, as it stands, requires that 14-day mandatory quarantine.
Yeah, I have very little to add other than to say that, again, the exemption for immediate family members still must be subject to the rigorous public health care controls which are in place as a means of reducing the risk of transmission for those entering into Canada.
Okay, great. You talked about as well that, a lot of people are asymptomatic and sometimes the test won't pick it up unless you have enough of the viral load. You also mentioned that Canadians should be monitoring themselves for symptoms and keeping an eye on it if they attended any of the rallies across Canada this week. So what is your advice to Canadians who attended those rallies, including the Prime Minister? Would you advise them to remain isolated this week and get a COVID-19 test, in 5 to 7 days?
So I think the advice is monitor your symptoms. However, I think depending on what actually happened to you and, in terms of during the protest and you're concerned about having been exposed, because people sometimes don't wear their mask properly or they didn't have access to hand washing, etc., and they're concerned, then, talk to your public health about getting a test. I know that, for example, in Ontario, so if you're in Ottawa, the Ontario Public Health is open to testing people who are concerned about having been exposed. So I think definitely call the health line and follow the instructions of the local public health about getting a test.
Advise the Prime Minister to get a test?
I don't know his particular circumstances, but he should also evaluate what actually happened to him, monitor his symptoms, and talk to public health and get a test as needed.
Dr. The only thing I would add to that is that even if you did go get a test and it's negative, you're not in the clear, right? Certainly you still need to keep monitoring for symptoms. If you become ill, even after, quote, following a negative test, it's important to talk again to public health and see if that maybe you should get another test, because as Dr. Tam and I mentioned, it's very possible that if you go, quote, at the wrong time, you may well be infected with the virus, but the timing of the test, you end up being negative, then you might have a false sense of assurance saying, oh, I'm good, I don't have the SARS-CoV-2 virus, and then, bang, 3-4 days later, you do become ill, and then you might think, well, I did have the negative test, so I can have COVID-19, but that might not be the case. So,
thank you, Doctor. Just a friendly reminder, one question, one follow-up. Brian, over to you.
This is a question for Minister Mendicino on temporary foreign workers. Cramped living conditions, working in close proximity, and now 2 deaths. Does Canada need to rethink how to safely deploy temporary foreign workers in farms across the country so they can continue their essential job of putting food on the tables of Canadians? And what specifically can be done?
Well, let me begin by expressing my sympathy to the 2 migrant workers that I'm aware of who have passed away from COVID-19 while coming to Canada to ensure that Canadians can still get access to safe and affordable food. And it goes without saying that we are concerned about the reports of outbreaks on farms and at food processing plants across the country. And we're working very, very closely with our provincial partners as well as the farmers and the employers who welcome the temporary workers. We have put into place a number of investments and supports to ensure that every temporary foreign worker can apply their trade in a safe and healthy environment. We provided $50 million to farmers, which would be distributed to workers, $1,500 per individual. We have also put into place a number of inspection powers so that the Government of Canada, in conjunction with the province, can actually go to these sites and evaluate whether or not the distancing, the accommodations, which were designed to be facilitated by those investments, are actually taking place. And I know that representatives from our government, our level of government, are continuing to undertake those inspections. And we will continue to examine ways in which we can raise the level of health and safety in our food processing plants and on our farms, because we know this is very important.
And what's it going to take to make these conditions safer for these workers? Obviously, the cramped living conditions are a concern, but what can be done on the ground to make sure that they're safe?
Well, first and foremost, we need continued collaboration between our level of government and our provincial counterparts, and certainly for my part, but I know as well, Minister Bibeau, Minister Qualtrough, Minister Jordan have all been in very close and consistent touch with their counterparts as well to ensure that we are protecting the health and safety of migrant workers and indeed all Canadians who work on farms. And from that cooperation, we hope to exercise the inspection and the regulatory powers which were brought in as a response to COVID-19, and also to look at ways in which we can deliver the financial support that is necessary to create that space, to create those accommodations which allow workers the distance that they need to abide by the 14-day isolation period, which is one of the cornerstones of our strategy in welcoming temporary residents and indeed all returning travelers to Canada.
Thank you, Minister. Nous allons maintenant retourner au téléphone. Opératrice, prochaine question.
Thank you. Merci. The next question, la prochaine question is from Lauren Gardner from Politico. Please go ahead.
Hi, this question is for Minister Mendicino. Brian Higgins, a congressman in the United States from the Buffalo area, has called for the Canadian and U.S. governments to do more to allow families who are separated by the border to see each other, but also for Americans who own homes in Canada to be able to cross to check on them. Given today's announcement about families being able to see each other, do you have any response to his ask that Americans or those living on this side of the border who do own property in Canada, whether they might be able to, at some point this summer, be able to go check on those properties?
Well, the first thing that I would say is that the current non-essential travel agreement that we have in place with the United States is the product of extensive collaboration between our two governments, which is a reflection of the long-standing relationship and close friendship between our two countries, as well as the border that we share. It's important to note that the exemption that we announced today is very incremental. It's very targeted and focused on immediate family members who have relatives who are Canadian citizens and Canadian permanent residents, as a way to keep them together throughout this very unprecedented time without in any way compromising the health and safety of Canadians while we manage our response to the pandemic. Other examples of travel, like the ones that you've mentioned and the ones that have been discussed south of the border, are not captured by this exemption, and so will still be subject to all of the screens which we have in place in the border, which really attempts to focus the nature of the travel as being essential and non-discretionary.
Lauren, follow-up?
Can you clarify the exemption that was announced today? Is that effective immediately, or is this going to be effective come the next deadline in a couple of weeks for the agreement to be renewed?
It's already come into force, and I believe the in effect date is June 5th, and we will verify that for you.
Thank you, Minister. Operator, last question, please.
Thank you. Merci. The last question, la dernière question, is from Catherine Lévesque de la Presse canadienne. À vous la parole.
Oui, bonjour. Mes questions sont aussi pour Monsieur Mendicino.
My questions are for Mr. Mendicino. I want to make sure of something. You say that what was announced today has been in effect for 3 days now?
Je pense que c'est une clarification.
I think a clarification
je regarde à mon équipe, mais la loi devient sans force aujourd'hui, ce soir.
The law comes into effect today, tonight. That's the clarification. I apologize. Midnight tonight.
Now they're all looking and nodding.
Okay. OK, donc, juste pour être clair,
so to be clear,
à partir de ce
it
soir
comes into effect tonight at midnight, and then people can come into the country starting tomorrow.
Une autre précision, une question, est-ce qu'on parle des familles séparées par la frontière américaine seulement?
Are we talking about people coming through the American border only, or everywhere in the world where separated family members can come back? And I'm wondering how your government convinced the reluctant provinces like Ontario and Quebec to agree to that exemption at the border.
Cette exemption s'applique dans le contexte de notre entente avec les États-Unis et c'est un produit de consultations avec nos experts publics dans la santé et même avec beaucoup de discussions et de consultations avec nos partenaires et nos homologues provinciaux.
OK, donc c'est juste les personnes aux États-Unis qui peuvent revenir, pas ailleurs.
Is that correct?
Yes. Merci, Monsieur le Ministre. Une toute dernière question au téléphone. One last question.
Thank you. Merci. The next question, la prochaine question est de Hélène Bilotti du Devoir. À vous la parole.
Oui, bonjour, Monsieur Nou. J'aimerais revenir à la question, aux questions de mes collègues de TVA, je crois, par rapport aux manifestations anti-racisme. Quelle est la recommandation de la santé publique? Ces manifestations-là doivent-elles être évitées? Et si vous ne donnez pas cette consigne, qu'est-ce que vous dites aux gens qui se plaignent qu'ils ne peuvent pas aller à l'église, ne peuvent pas célébrer les funérailles de leurs êtres proches au nom de la pandémie, alors qu'en même temps, vous permettez ces manifestations?
Merci pour la question. Comme j'ai déjà dit à votre collègue, c'est vraiment un équilibre entre deux enjeux. Le premier enjeu, c'est vraiment, je pense, un enjeu très important pour la société en général, le racisme systémique, les inégalités de notre société, qui a aussi un effet sur la santé et sécurité pour toutes les personnes qui vivent dans notre société. Comme moi, comme un hygiéniste spécialiste dans la santé publique, j'apprécie bien ce enjeu important. Le deuxième enjeu, c'est oui, maintenant, avec tous les événements qui se passent, c'est pendant une pandémie de la COVID-19. Donc, c'est quoi l'équilibre entre le droit des Canadiens qui reconnaître l'importance de premier enjeu de manifester, c'est le droit dans une démocratie, et aussi respecter toutes les mesures de santé publique, même les mesures de protection individuelle. Pour nous autres de santé publique, on peut toujours donner c'est quoi les recommandations de santé publique en général. En fin de compte, c'est aussi c'est très important de aussi suivre les consignes, les recommandations à l'échelle locale. C'est aussi les autorités sanitaires de la ville d'Ottawa et de la province de l'Ontario. Ce que Dr. Tam et moi on dit à l'échelle fédérale, c'est comme des lignes directrices, des mesures, des principes de santé publique. Donc, tout le monde comprend bien. C'est très important de garder une distance de 2 mètres. Et si ce n'est pas possible, si on sort de la maison, utiliser une couvre-visage, aussi avoir beaucoup de désinfectants pour les mains, tout ça. Donc, pour moi, en fin de compte, c'est aussi une question de, comment dire, auto-évaluation des risques. Si on a aussi des autres problèmes de santé, des conditions chroniques, des autres conditions sous-jacentes, c'est aussi peut-être une autre considération, mais en fin de compte, je pense qu'on ne peut pas arrêter les gens qui veulent faire quelque chose très important pour eux-mêmes. Et ce que je dis, c'est au moins on peut donner c'est quoi les recommandations des mesures de santé publique pour mieux se protéger et aussi protéger la santé et sécurité des autres. Merci.
Et ma sous-question serait pour M. Duclos. Il y a un projet de loi, dit-on, que votre gouvernement veut déposer cette semaine. On comprend entre les lignes que ce serait pour modifier la prestation canadienne d'urgence. Qu'est-ce que vous pouvez nous en dire? Songez-vous à la prolonger?
Merci, vous avez effectivement raison. Il y a des discussions qui ont présentement lieu avec les partis de l'opposition pour voir comment améliorer la suite, dans le sens que nous avons évidemment mis en place des mesures substantielles au cours des dernières semaines, mais ces mesures dès le départ étaient des mesures d'urgence et donc temporaires. Et c'est pour ça que nous sommes présentement en discussion avec les partis d'opposition. J'aimerais vous en dire davantage présentement, mais malheureusement, on va devoir être un peu plus patient. So, as was clear from the start, and as Canadians noticed quickly, we did put into place strong and efficient measures in reaction to the emergency, but clearly those emergency measures were emergency measures and therefore designed to be non-permanent, and that's why we are currently in discussion with opposition parties in the way forward to see how we can improve on those measures, and there will be more to say at some point, but not now.
Thank you, Minister. Ceci met fin à la conférence de presse pour aujourd'hui. That's it for today. Thank you, everyone.